We are calling to you today from Toronto. I've got Andrea Horwath, NDP Leader here. I think everybody by now is probably familiar with our dental care for everyone announcement. So we're going to let her open it up with just a couple minutes of comments, and then she'll take your questions. Just a reminder, *6 to mute your line so that everybody can get good audio quality, and *7 to unmute your line and jump in and ask a question. So I'll turn it over now to Andrea Horwath.
Good morning, everyone, or good afternoon, I guess it is by now. I want to thank you for calling in. Today I was proud to put forward the details of our dental plan for everyone that's changed for the better for the people of Ontario. We laid out both how people can get benefits, dental coverage in our province with the NDP plan, whether you're a worker or whether you're someone who's a senior, for example, who's lost their benefits after 65, or whether you're a person on social assistance. So there are kind of two streams, if you will, to our plan. I believe it's up on the internet, and so it's available in terms of the specific details. But it is a plan that we're confident we can implement and cover people across this province who now don't have coverage. And what that means for folks is making really horrifying decisions. I mean, families that have to put off their kids' checkups or even having their cavities filled because they can't afford it. We've heard stories from moms, for example, who have just finished, single moms who have just finished paying off their credit cards only to have to go back into debt again to get a major dental work done on one of their children. Seniors who were getting care while they were still kind of working, and as they retired at 65, all of a sudden no dental care because their plan doesn't extend beyond 65. Every 3 minutes in Ontario, every 3 minutes, someone is accessing either a doctor, like a family doctor, or emergency room to try to deal with pain in their mouth. This is a big problem. And our plan solves it. It leaves in place what we already have. So the 2/3 of employers that already provide dental benefits to their employees will continue to do so. The 1/3 that don't, our plan will require them to do so, providing a basic level of service that we've outlined, and more details of that will come as we design the plan. But it's an exciting announcement from our perspective, and it's something that has long been past due to ensure that we're taking care of all of Ontarians. And just one of the family physicians that was with us this morning in the press studio, the media studio here, said that she sees all kinds of patients that have problems, and she described it as, we have a Medicare system that takes care of the whole body except for the mouth, and that needs to change. So I'm going to leave it at that and ask if there's any questions that people want to raise.
Andrea, it's James Murray with Net News Ledger. How much is this going to cost, and where's the funds going to come from?
Thanks, James. So the full program is $1.2 billion. We expect to be able to start implementation in 2020, so we're going to work very hard the minute we take the reins of government to put this plan together and get it out the door. The $1.2 billion partially covers off the social assistance and senior side, and the rest is for the covering off the costs for lower income workers. So one of the things I didn't mention is workers who are earning under $30,000 will have the benefits, the dental benefits for themselves and their families, but their portion of the fees or of the costs that the workers would pay will be fully refundable. We'll have a sliding scale for folks between $30,000 and $50,000, and over $50,000 people will pay the premiums themselves at over $50,000. But in no situation will anybody be paying more than about $4, like 2 cups of coffee a week for full dental coverage, or at least dental coverage for the vast majority of services like cleanings and fillings and dentures that are medically necessary, all of those pieces.
Jay McWitch.
Anybody else?
Just a reminder, if anybody's on mute, star 7 to unmute your line and jump in and ask a question.
Hi, it's Patty in Windsor calling. Just wondering how this will affect companies. Like, we're talking big companies that have big medical benefits, such as the auto companies and things, and, that are represented by Unifor. How does it all play out for them?
Well, you know what, Patty, when we designed our plan, we looked at the fact that 2/3 of employers already have benefit plans for their employees, and they put those plans in place purposely. I mean, I think employers recognize that benefit plans and dental plans help with employee retention and with employee wellness, and they're an incentive to their workers, and they keep people loyal in terms of commitment to to staying with the company. We know that lots of smaller employers, so mom and pops, who want to provide some kind of benefit, want to be able to be on a level playing field with some of these other companies, don't have the opportunity to do that. It's an onerous task to have a benefit plan in place. It's something that folks in many cases would like to do. And so what we're offering is what we're saying is Ontario Benefits is not there to solve something that's already in place, which is the 2/3 of employers, but rather the 1/3 of workers who are not covered by a workplace plan. And the other thing that our plan does is it's going to take care of folks who are in the very precarious economy that we have. So we have people who are who are contractors, people who are in the arts, for example, in the gig economy, folks who are not working at traditional work anymore, and that segment of the workforce is growing. And so we really need to design a plan that takes care of those folks as well, and that's what our plan will do. So it's not so those employers that already provide employee benefit plans, they will not be impacted at all. It's those other 1/3 of employers that are going to be asked to step up and make sure that there's a basic level of service provided to their employees.
What if the companies drop out of offering dental, so knowing that the government would pick up on it?
Well, one of the things that we've found is that, there's a reason why employers already have these plans in place. It's because they attract a good, stable workforce. And so we don't expect that we'll see these, in what many cases are very generous plans, slide in the opposite direction. We think quite the opposite, and the evidence has shown that these are things that employers use as a positive incentive for workers. We don't expect them to start sliding backwards, quite the opposite.
Mike Gerskin, Manitoulin Expositor. Do I understand correctly from your previous comments that employers will be the ones that'll be primarily picking up the cost in the private sector?
Well, similar to the plans that exist now, there will be contributions by both employer and employee, and that's what we will see with our plan. And so, yes, employers will be covering off a similar amount as what the current employers cover off. So right now, what our research shows is that employers are covering about 80% of the premium, whereas the worker is covering off about 20. Our plan has a 75-25 split, so it's very similar. The real big difference is that our plan will take into consideration low-income workers. So all workers will be covered. Nobody will be without coverage if they're working. The lower-income workers, 30,000 and under, will have all of their premiums refunded, and between 30 and 50,000, we'll have a sliding scale in terms of refund, and then, as I said, over 50,000 will be paying their direct premium.
So this will be a user pay and then get a refund for the
so it is a cost. So it is cost shared, employer and employee. We haven't designed the fine detail of the plan, but there's two principles that we really want to ensure. One is that lower income workers are not having to have a heavy burden, and so we don't want to hurt people that are already having a hard time. That's why we put the refund in place. We're hoping that implementation will enable us to provide, those refunds regularly as opposed to just once a year. So we're hoping for that. The other piece is that we want to make sure people are able to access dental care at their own choice. Do you know what I mean? And so on top of the the employee plans that we are now talking about requiring, we are also going to make sure that, as I said, seniors and folks who are on social assistance are able to get dental care. And we know that there are parts of our province where that's not easily occurring right now even. I mean, there are lots of small towns and smaller communities around the province in the north where there isn't a dentist in town. So we're doing a couple of things to ensure accessibility occurs. So not just financial accessibility, but also physical accessibility, including expansion of our community health centers to be able to, we're going to put a bunch of new dental theaters into these community health centers and our Aboriginal health centers as well. We're also going to put on the road about 7 dental health buses that will help us get in and out of communities to provide those maintenance and emergency services that folks need. And so our plan's quite comprehensive because we don't want anybody in our province at all to be without access to dental care.
Any more questions?
Yes, Doug Draper, Niagara at Large. Andrea, just playing the devil's advocate here, what is your possible response is going to be to those out there who say that, here's the NDP, great, sounds like a great idea, but bankrupting the books again, or possibly going to do that. And those who say, for example, that the Liberals have appropriated a lot of your ideas, so here you are, you're pushing you further to the left. And I also wonder about the chambers of commerce that the backlash on minimum wage, whether you're prepared for the possibility of them being highly critical of this because of the possible cost to business.
Sure, Doug. Well, thank you for those questions. I think it's important to realize that we were very clear about our commitment to making sure that when we are bringing something forward, that we're giving the business community a heads up. I mean, I've met with the Chamber of Commerce of Ontario many times, and one of the things that they said is we don't like surprises. So we've not only let them know that this is something that we're planning on doing, but we will be engaging them in the rollout and in the design of the program as we go forward. And I think that that's something that they will appreciate. Will it mean that some of their members will see about a 1% payroll implication? Absolutely, they will. But again, we're aiming for 2020. So we're aiming for 2020. So there's a couple of years of opportunity for folks to get ready for that. It's not like we're springing it on them on the eve of an election, like some other policies have recently been implemented by the Liberal government. Having said that, the issue of the cost of the program, we have a very good platform that we're very proud of. We mentioned yesterday 5 of our priorities, but our platform's got a number of other very progressive pieces to it and very exciting initiatives that we're going to undertake. The bottom line is this: the Liberals can promise all they want right now. They've been in office for 15 years. Anything that they promised, they could have achieved already. What we've seen instead is a Liberal government that's cut services, that squeezed our hospitals, that sold off Hydro One. 80% of the people of Ontario don't want this government in office anymore, but they don't want to have to choose between bad and worse, between Liberals and Conservatives, between Wynne and Ford. And what we're offering is a vision for the future of this province that makes life better for folks, that actually addresses the needs and concerns that they have. And so, yes, it's an expensive program, but it's one that's desperately needed. I mean, we have, as I said, every 3 minutes, somebody going to emerge or going to a doctor to try to get their teeth dealt with. We did not include, what I meant to comment on around our platform, though, is that our platform will come out and it will have with it a very responsible fiscal plan, so people can see exactly where the money's coming from, if you will, how it's going to be invested in the services that people need, and that's coming in a couple of weeks' time. But what we know for sure is that people shouldn't have to be lined up in hallways, for example, in hospitals, waiting for care. People shouldn't be stuck in foreign countries, not being able to get back into Ontario to be able to get the care that they need in their own province. The Liberals have had 15 years. They've caused a lot of damage, and we are certainly prepared to fix that in a way that is prudent. One of the things we didn't do when we costed out our dental plan is we didn't add in any savings from the reduction of pressure on ERs, the reduction of demand at doctors' offices, because people will no longer need to do that because they'll be able to get dental care where they should be getting it. We didn't include those savings, and so we know there will be some. But again, our plan is one that's very prudent in that regard. We can't put a financial number on. We can't put a specific number on what those savings will be, but we know that they'll be there.
Can you
think
point
that's all
to?
of the ones that you were asking.
Yes. Can I just one more?
Sure.
If possible. Can you point to any other jurisdictions in the world where something like this, close to what you're advocating, or
Sure, there's a couple of things.
is already taking place?
Yeah, sure. There's a couple of things. I mean, just on the dental benefits and having dental benefits as part of a Medicare system, we know that a number of jurisdictions, particularly in Europe, have already got these things in place that are kind of companions of their Medicare system. Several of them are ones that include employer and employee contributions. So yes, those models do exist. Although we're excited. I mean, this is absolutely cutting edge for Canada. It's cutting edge for Canada, and we're excited about that. And we think the time has come for us to take this huge gap in our Medicare system seriously and do something about it. The other thing, Doug, is that there are other jurisdictions that have also acknowledged and recognized that the nature of work is changing, and that there are far too many workers now, and it's going to just increase by the looks of things, that don't have traditional work anymore, that aren't with a traditional employer, that are finding unique ways to make a living, and we need to cover off those folks as well. And so jurisdictions, for example, like New York and like Washington, have both got commissions underway to determine how they're going to respond to this need. So we are going to be using some of their kind of work, as well as engage experts here in Ontario and experts from around the world, really, to try to get at that particular group, because that's the most challenging group to serve. When we come with our plan in 2020 completely ready to go, it will include some of those unique challenges being covered off.
Thank you.
Thank you.
Last call. Any more questions?
Nick Liard from Rogers Radio in Sudbury. How you doing, Andrea?
Good, thanks, Nick. How are you?
Not too bad. Maybe I missed it, but you talked about this really helping low-income families and seniors, but I'm not sure if you stated where that kind of cost. You said that those who are working, it'll be covered off with help with the employer, but those who are not working or seniors, how is the government planning to pay for that?
Sure, no, that's a really good question. It's kind of like a two-streamed program. The one stream is workers, and they will get covered through an employer benefits plan, which will, with the smaller employers, the one-third that aren't providing, we'll develop Ontario benefits, which will be a province-wide benefit plan for those employers to take advantage of. On the other side, the seniors and people on social assistance who right now don't have the coverage at all, they will be able to access dental coverage through their OHIP card, and we will be making sure that the dentists and or the community health centers, public health units, or the buses are able to be there to provide services. So they will be accessing through their OHIP cards without any upfront cost out of their pocket, because we know that they can't afford it, and we will be directly reimbursing the provider.
Thank you very much.
Thank you, Nick.
Anyone else? Last call for questions? Okay, thanks so much for joining us, folks. As you know, you can get a hold of any of the media relations staff on Andrea's team if you have follow-up questions or details. The full book has been sent to all of you, the policy on this. And if not, flip us a note and we'll send you a copy or send you a link to download it. And of course, if you need to get a hold of me, it's Erin Morrison, emorrison@ndp.on.ca. And thanks very much for joining us. Have a great afternoon.
Thanks, everyone.